A very good day to everyone. I am Dr. Murali. I work as a senior consultant in cardiac anesthesia and critical care at MGM Healthcare. In this series of lectures on ECMO, today we'll be dealing a talk on cannulation for a patient who has to be put on ECMO. So let's look at it in one by one. So this is the overview of the talk. One, we'll look at what are the different types of cannula, then what is a cannulation technique, and finally, how do we position this cannula in that particular patient. So this is a VA ECMO. So as you see here, this particular patient is having two cannula there, one an arterial cannula, the other one a venous cannula, and then you have connected that to the ECMO circuit. These are two different types of veno-venous ECMO. Both of these again have two cannulae. One, this video, it shows that this particular patient is having drainage from the leg. That is, you have used the femoral vein IVC reed to drain. It comes to the ECMO. Then the post-membrane blood, which is bright there. This is a post-membrane bright blood that goes back to the patient. And the return cannula we have put in the neck. So this is a femorojugular combination of a two separate cannula for the VV ECMO. This is the other configuration where again you have two separate cannula, but both are being placed through the femoral approach only. There is nothing there in the neck. You see that in the leg level you have two cannula. One femoral vein is used for drainage, the one in the dark color relatively, and after going to the ECMO, the one that comes back is the brighter one. This is through the other femoral vein. So two cannulas, one through the right femoral, the other one through the left femoral vein, positioned in the IVC and in the RA respectively, are used for a veno-venous ECMO. This is a fem-fem veno-venous ECMO combination. This is. Then, so what are the different types of cannulas we have? We have two types of cannula. One, you have a single stage cannula. Single stage cannula means a cannula which works only as one. Either it can work as a drainage or it can work as a return. Then the second one is a dual stage cannula. Dual stage cannula means there will be only one cannula through which you can use both as a drainage and as a return. This is used only for the veno-venous ECMO. You cannot use it for VA ECMO, VAV ECMO, all this. You can use it only for the VV ECMO. Apart from this, what you need to know about cannulas are what is the size of the cannula, what is the length of this particular cannula, what is the location of the holes for drainage in that particular cannula. So as you see here, these are all the drainage cannulas. Drainage means most commonly the venous cannulas there. As you see, these cannulas, both of them are of same type, but what you see is the difference is the location of the holes. In this particular cannula, which is above, you have holes in the distal part, and in between there is an area where there are no drainage holes. Then again there are some holes here. Whereas in the lower one, it has a continuous holes from the distal to a certain level down there. So you need to know very clearly what type of cannula you are using, what is the hole configuration, and that should suit to your requirement. For suppose this cannula, you can place that this part can be in the SPC, this part can be in the IVC. Nothing will be there in the RA. So effectively this can drain for a veno-venous very well. Whereas you cannot do the same with this cannula because there are holes in between. This, if they are in the RA, they keep sucking and that lead to the problem of recirculation in the veno-venous ECMO. So one, you need to know what are the location of the holes. Then you need to know what is the length of the cannula. They all have markings here. We cannot see that very clearly. That markings will tell you what is the length from the tip or the distal end. So like 30, 40, 50 centimeters. So that helps you to know how deep you are inside and also mark the point where you have fixed the cannula at the skin level. Then you need to know the size. On every cannula, it will be clearly marked what is the size of the cannula. So obviously, that's what you look at when you make a choice, what size of cannula you want there. This is the other type of cannula which is used for return. So the other one what we see previously was the drainage. These are used for return. When you say return, you are using in the venous side for a VV ECMO and the arterial side for a veno-arterial ECMO. What is the difference? The difference is you don't have multi-hole drainage in them or multi-hole return. Usually you have holes only at the tip. At the maximum, another set of holes may be there just little short of the tip. Otherwise, you don't have holes at the entire level. Apart from that, like in the previous cannula, you clearly have markings of the length of the cannula, which you need to make a note of that. Like you see here, different markings, what is the length, and the size of the cannula will be marked here, which you need to see before you make a choice there. Then you have a side port in this. In this particular case, it is closed, but if you are using it for a veno-arterial configuration, in this side port, you put a 3-way, and then you use it for perfusing the distal limb in these patients. So what is the other type of cannula? As I said, dual stage cannula or a single cannula.